Good afternoon. How are you? I hope you're okay and well. I hope also you're keeping safe wherever you are. So today I want us to go through stages of disease prevention, topic 2. And before even we go to the stages of disease development, I want us first to understand the stages under which disease develops. We also call it natural history of disease, or the disease development progress. You can call it natural history of disease. You can also call it stages of disease development. You can also call it the stages of disease occurrence. So for a disease to occur, it doesn't just appear. You don't just wake up in the morning that you're sick. It have to start in stages. There is a stage number 1, where we call these stages of well-being, where you're healthy, and also the causes of disease or the risk factors that normally causes a disease are not present at that time. So the stages of well-being, it means a place where a person do not have any signs or symptoms, and also the risk factors are also not present. Then number 2, we have susceptible stage, and this is where the risk factors are now present, and that person or a person who is vulnerable to getting that disease is exposed to a risk factor. For example, let's take an example of malaria. So I was on the stage of susceptibility. So at this time, the person who is at risk of getting a certain disease, who is susceptible to a certain disease, is exposed to a risk factor. I was giving an example of malaria. For example, malaria, the first stage is when we don't have bushes around, we don't have stagnant around surrounding us or surrounding the place you're living. The place is clean. We don't have any condition that normally accelerates the existence of or causes the existence of mosquitoes surrounding us. Then the second stage, it's when we have all the conditions that are necessary for mosquito to grow in a certain area. That is maybe bushes, we have stagnant water, we have dampness in a place. So at those conditions normally helps the mosquito to grow. So at that stage is the susceptible stage. So those that are vulnerable to getting the malaria are present, as well as the risk factors are also present, but still they do not have the infection because we are still at the susceptible stage. We only have now the risk factor that were not present in the last phase. Then in that phase is asymptomatic or pre-symptomatic stage. At this stage, the infection have already occurred. So now the mosquito have already bitten you in presence of the parasite that normally causes mosquito. So at this stage, you're not really sure. There's some vague signs and symptoms that are not very clear. You're not sure whether you have malaria, whether you're having a cold, whether you're having, the symptoms are not very clear. At this time, people may ignore the symptoms. majority of people normally ignore the symptoms, or they can just go to the pharmacy and buy some maybe painkiller or something, maybe because they're having some headache. They're not clear signs and symptoms at this stage. But remember, we have infection and some symptoms that are vague. They're not that clear. Then the fourth stage is the curative stage, where at this time the signs and symptoms are very clear and are very evident. At that time, majority of people go to hospitals because they are feeling really sick. They're feeling sick at this stage. So at this stage, that's when this stage will also determine the next stage. Because if you went to hospitals and you were cured, if your immune status was very weak, or if your immune status was very strong, and it overcame the disease, you will cure. If the immune status was very, very weak, you were forced to go to the hospital because you didn't cure on yourself. So if you went to the hospital, you might be cured also, you might die. Then another thing, if you went to the hospital when the disease was very severe, the disease might go to chronicity level, or the disease might even cause disability in you. So curative stage determine the fifth stage, that is recovery, disability stage. You also have chronicity stage. The disease may develop into chronicity, for example, TB. If it was not cured early, it might develop to chronicity, where we'll stay with it for a very long time. The disease, for example, some cancers may develop to chronicity, because some cancers can be cured at the first stage. But if you went to the hospital, or you were misdiagnosed at first and then you were diagnosed later, the disease may be at the severe stage, and at this stage, the disease have already developed into a chronicity, where it's a terminal stage, a terminal disease now, where you will stay and live with the disease for a very long time. Then the sixth stage is death. So, see, the sixth stage might not happen, because if you recover, you will not die. But the sixth stage might happen if the disease developed to severe stage. So those are the stages of disease development, which are discussed one by one. We'll start with well-being. I've already stated we have no medical problems, you have no risk factors. Then susceptible stage, we have the risk factors now that causes the infection, but still the infection is not existing. But at the pre-symptomatic stage, we have vague signs and symptoms. Remember, it's vague. It's not no signs and symptoms. It's supposed to be vague signs and symptoms. And at this stage, because already infection have already started or have already occurred, you can be diagnosed with the disease if you're taken to the laboratory. But you might be misdiagnosed with the disease if you go to the hospital and they don't take you to the laboratory. If they are just using the signs and symptoms, they might misdiagnose malaria with typhoid, with cholera, with whatever. Then the next stage is symptomatic stage, where we now have clear signs and symptoms are felt and seen. And at this time, majority of the patients will go to see a doctor. And then this stage will also determine the next stage, where we have disability or recovery stage or chronicity stage. So the patient can either recuperate or deteriorate to disability, depending on the severity of the illness and the mode of management use. And also something else is the level of your immunity. Then the next is disease, where you ultimately die if the disease was recovered when it was at a very severe stage, and many other factors. Then let's now see what are these levels of disease prevention I was talking about. We have primordial prevention stage, we have primary prevention stage, we have secondary prevention stage, we have tertiary prevention stage. So we'll cover one stage at a time. Let's start with the primordial prevention. So at this time, or this prevention is normally directed to healthy individuals that are not even at risk. They're just healthy. If you go to a group of women that are in a chama, those women do not have any health conditions. Whatever topic that you want to pick and talk to them about concerning health will concern the general health. You can't go to talk about, for example, you cannot go to talk about malaria if they do not have malaria. You have to talk about, for example, you can't talk about how to treat malaria to people who are healthy, but you can talk to them how to prevent themselves from getting malaria. You're talking to healthy individuals. You're talking to healthy individuals. And it's the main intervention here is health education. How do you eat well in order to prevent yourself from getting cancer? How do you eat well in order for you to prevent your children from getting malnutrition? How do drug abuse affect the health of an individual? How do what are the lifestyles can we adopt? If, for example, you're talking to people working in a bank, what kind of lifestyle can you explain to them to adopt in order for them to remain healthy? You can tell them to exercise now and then because majority of them are sedentary or have a sedentary lifestyle because of the work they are involved in. So these topics will be under health. You are educating people on how to stay healthy, on how to adopt a healthy lifestyle, how to adopt good lifestyle, how to adopt healthy lifestyle that will help them prevent themselves from getting diseases. So it's a relative new concept in receiving special attention in the prevention of chronic diseases. Example, many adult health problems such as obesity, hypertension have their early origins in childhood because this is the time when lifestyles are formed, e.g. smoking, eating patterns, physical exercises. So you can explain to them what are these risk factors to some certain people who are healthy, and you're helping those people who are healthy. So primordial prevention begins in childhood when health risk behavior begins. Parents, teachers, and peer groups are important in imparting health education to children. Examples of this primordial prevention include national policies and programs. For example, food security and nutrition. Now and then we are being taught, or you are being educated on how to improve food security at a personal level, at the family level, at the community level, at even the international level or national level. Then we are being taught on how do we eat well in our televisions, in our groups, in our churches. So this food and nutrition, or food security and nutrition policy or program, it's very wide in Kenya. Then another one is comprehensive policies for discouraging smoking and alcohol abuse, as well as other drugs. We also have policies that normally discourage the smoking, discourage alcohol use, as other drug abuse. This is through youth camps, through youth groups, and many others. Then we have to promote regular physical activity. It's another program. And another one is making major changes in lifestyle. So these are the programs or some topics that you can pick and talk to people about. You can talk to any person, whether healthy or not healthy, concerning physical activity, because it's wide. It covers, or it suits everyone. You can talk to a person or to any person about lifestyle because it will affect whether you're sick or not. So health education normally focuses on the prevention of the development of chronic diseases, especially the chronic diseases. But you can still use health education in preventing the acute diseases from occurring. You can use health education to treat people, or not to treat, or to teach people on how to overcome cholera outbreaks in a slum. You can use health education to treat people on how to overcome malnutrition in children. You can treat people on how to overcome alcohol and drug abuse or addiction in a certain area. So this normally primordial prevention is normally focused majority or in many ways in the prevention of future occurrence of a particular disease, and especially the chronic diseases. Then the second one is primary prevention. So primary prevention can be determined as the action taken prior to the onset of the disease. This removes the possibility that the disease will occur. So this prevention is normally taken before the disease occurs by removing the risk factor. So you remove the risk factor first before the disease have already occurred. It's not like in the primordial where you're dealing in future occurrence that you're thinking that might occur in a person. But as for this one, you remove the risk factor before the disease have already occurred. So at this time, you're preventing the second stage of disease development, which we said the risk factors are present and the people at risk are also present. So remember in the first stage where every person is okay, the person is healthy, there are no risk factor for a disease to occur. So at that time, that's when you can use primordial because you don't have any present risk factor for a disease to occur. And I use example of malaria. So for malaria to occur, we have to have mosquitoes. And for mosquitoes to be there, we have to have some bushes, we have to have some stagnant water in a certain area. So primordial will prevent the disease from occurring in future. So preventing the first stage of disease occurrence. Then for primary prevention, it will prevent the disease from occurring by removing the present risk factor, meaning that at the second stage, that's where the second stage of disease development, that's where the primary prevention will chip in. So in this action are taken before the onset of the disease, then it signifies intention in the pre-pathogenesis phase of a disease or health problem. So it will bring some intervention. It normally brings some intervention before the disease has started to occur. The infection have not yet occurred now. So primary prevention will just remove the risk factor, and hence the person will not be infected by the risk factor. Then it includes the concept of positive health, a concept that encourages the achievement and maintenance of an acceptable level of health that will enable every individual to lead a socially and economically productive life. So examples of primary prevention is health promotion interventions and strategies. And as the name states, you're promoting health through interventions and strategies. So it is the process of enabling people to increase control over the determinant of health and thereby improving their health. You're empowering people in order to control the risk factor or to overcome the risk factor. If you empower a person or give them education or you give them the knowledge that mosquitoes are brought about by bushes around you, around your homestead, stagnant water around your homestead. So the person will be empowered in order to control the existence of mosquitoes surrounding that person. That's why that is the definition of health promotion intervention and strategies. So these health promotion intervention strategies, we have two. We have number one, health education, and this improves healthy habits and health consciousness in the community. For example, if you identify that majority of people in a certain area, in a certain slum or in a certain village are suffering from malnutrition, or not are suffering, are at risk of getting malnutrition. Remember, still here we are in the second stage of disease development. So if you identify that they are at risk because maybe they have enough food, but the way they are consuming the food is not in the right manner, or they do not have any food at all, but they're still not malnourished. So at that time, you can come up with nutrition intervention. You can come up with nutrition intervention such as feeding school-going children, that's encouraging people to go to schools, and by going to school, they will eat, even if it's 2 times in a day. You can come up with interventions such as distribution of vitamin A, maybe because you've noticed that there is risk of getting blindness or getting eye issues caused by lack of vitamin A in the diet. You can come up with many nutrition intervention depending on what the people are at risk of getting, or what type of malnutrition the people are at risk of getting. Then another one is environmental modification. So if you notice that the environment is untidy, we have sewage that is spilling all over, we have a lot of unclean water that are all over. So people are not yet sick because by cholera, or they're not sick of cholera, they're not sick of diarrhea, diseases, are not sick of malaria because of the bushes around or stagnant water around, but you have noticed we have that surrounding the people. So you can come up with environmental modification. Clean the area, use the people to clean the area, educate the people that you need to clean this area, you need to dispose the waste well, you don't need to dump any waste all over, because that will also affect your health. So those are environmental modification. Then another one is lifestyle and behavioral changes. If you notice that majority of people are abusing drugs, are abusing alcohol, are abusing smoking, are abusing heroin, are abusing even sexual misconduct in an area. So they're not yet sick due to the risk factors they're exposed to. But you need to remove that risk factor. You need to educate them. What is the harmful effect of smoking? What is the harmful effect of abuse of alcohol? What is the harmful effect of abuse of drugs? What is the harmful effect of sexual misconduct? And by that, you're using lifestyle and behavioral changes in order to remove the risk factor from causing diseases in those people. Then we have social protection as the second type of health promotion intervention and strategy. So for such specific protection, not social protection, it's supposed to be specific protection. At specific protection, you're targeting a specific risk factor. When you're doing nutrition intervention, you might target a lot of risk factors. When you're doing environmental modification, you might target a lot of risk factors. But as for this specific protection, you're targeting a specific risk factor causing a specific infection. And an example is immunization. When you're immunizing against TB by use of BCG, when you're immunizing against polio, when you're using polio vaccines, you're targeting a specific risk factor that the person is exposed to. Each and every person is exposed to polio viruses. Each and every person is exposed to TB causing microorganism. But if you target those who are at risk, that is the children, and give them vaccine against that risk factor, specific risk factor, you're doing specific protection against that risk factor. And another one is the use of specific nutrients. For example, you can give folic acids to pregnant women in order for them to be protected against birth defects of the unborn child. You're specifically targeting that infection that might affect the unborn child. When you're giving iron to pregnant women, or iron supplement to pregnant women, you're targeting anemia from occurring in that woman. So another one is chemoprophylaxis. We're giving drugs targeting a specific infection such as malaria, etc. Then we have protection against occupation hazards. When you're giving safety or PPEs, personal protective equipment or gears, you're protecting that person from any harmful effects that might occur during their work. If you're giving helmet to people working in quarry, you're preventing those people from getting injured on their head by the rocks that they normally work under. When you're giving people working in a hospital gloves, you're protecting those people against the infection they are supposed to be or they're exposed to during the line of their work. Then another one is protection against accidents, e.g. seat belts in our matatus. Then control of general environment and avoidance of allergens and etc. Specific protection. So health promotion strategies are normally used in primary prevention. And remember, primary prevention normally targets the risk factor before it infects the individual. So these health promotional strategies are normally used in primary prevention. We have health education and you have specific protection. Then we are done with secondary primary prevention. We are on the secondary prevention. What is all about this secondary prevention? This is an action which halts the progress of a disease at the curative stage. This is an action that normally halts or stops the disease at the curative stage. Remember the curative stage I talked about earlier. So the specific interventions here are number one, early diagnosis. You diagnose the disease early. You treat the disease. And then you discharge. If you're unable to treat the disease, you refer through the referral to a higher level. So during diagnosis, you can diagnose by just observing the signs and symptoms. You can also diagnose using laboratory tests. So we have screening tests, we have examinations such as breast self-examination, pap smear tests using diagnosis of things like TB. We have radiographics examination where you're taking x-rays. For example, if you are injured in your leg or you're broken, your bones are broken, you go to x-rays. And then we have treatment, and if that person is cured, you discharge them. If they're not cured and you are unable to help that person, you refer that person to a higher level of a hospital or even a specialty. Let's see, what is this early diagnosis? This is the disease complication. The disease complication can be prevented and health can be restored by diagnosing the disease at its early stage and by providing the adequate treatment according to the health problem. So you diagnose, you cure that person, hence preventing the disease from getting to a severe stage. And also, if the disease was communicable, you're also preventing the healthy from getting the disease from the sick person. And by that, you're also restoring the health status of that person. So this includes arresting or stopping the disease process, restoring health, treat the disease before irreversible pathological changes occurs. Because if you don't treat the disease, some of these diseases they might develop into chronicity, and the chronicity might also develop into disability, and the disability that person will stay with it forever. So another one is reverse the communicability of infectious diseases. That's why I was saying here, if you treat a person early and the person is having, for example, COVID-19, or that person is having a disease that is communicable to other people, then you're stopping or you're reversing the spread of that disease. Let's take an example of a COVID-19 that we're normally having nowadays. So if a person gets the COVID-19, and they're not treated early, that person might develop, and maybe the immunity is very low or very weak, that person might develop lung infections. And that lung infection is not also well diagnosed or early diagnosed, might develop in disability where the person's lungs will collapse, will not work. And due to that, they might end up having some disability because they're not able to breathe on themselves forever. So as you can see, early diagnosis is very important because it will arrest the disease or stop the disease from growing into a severe state, restore health to that person, and also treat the disease before it gets into an irreversible stage. Then lastly, reverse the communicability of infectious or communicable diseases. So secondary prevention attempts to arrest the disease process, restore health by seeking out unrecognized disease and treating it before irreversible pathological changes takes place, and reverse the communicability of infectious diseases. I've already explained this. It protects others in the community from acquiring the infection, and thus provide at once secondary prevention for the infected ones and the primary prevention for their potential contacts. Yes, by doing secondary prevention of some certain diseases, you're preventing also the healthy. Remember, the healthy are at risk. So by removing the risk person or by treating the risk person, you're removing the risk factor, by then hence you're doing primary prevention. Then what are the objectives of secondary prevention? Number one is cure and prevent the progression of the disease process. Then another one is to prevent the spread of diseases by curing the all known cases. Then the third one is prevent the complication and sequel of diseases. You're preventing the person from getting complications from the disease. And lastly, we have to shorten the period of disability. Then the fourth one is tertiary, and the last one is tertiary prevention. So what is tertiary prevention? So it is used when the disease process has advanced beyond its early stages. It is used when the disease process has advanced beyond its early stages. It has already grown to chronicity. It have already developed into stages that are not reversible. For example, if you're dealing with a person with COVID-19 that have already, the lungs have already been affected such as that it is very hard to reverse the lungs to their normal status. So if this person will have to live with this lung problem forever. So the tertiary prevention comes in. You don't just leave that person there. You have to come up with the tertiary prevention strategies. So it is defined as the all measures available to reduce or limit impairment and disability, and to promote the patient's adjustment to it. So in tertiary prevention, these are measures that are normally used in order to limit or even to reduce impairments and disabilities and to promote the patient's adjustment to irremediable conditions. So I was using an example of COVID-19. If the person have already developed lung problems, you don't leave that person there. You have to prevent other disabilities or other issues from getting into that person. Because once you leave that person there, the lung will completely collapse, or their kidneys will start to have issues. Other organs like heart will also start to have issues because the lungs are not working well, or the body is not supplied oxygen, or even carbon dioxide is not removed from the body as it's supposed to be. So due to that, your number is supposed to limit or even reduce the occurrence of impairment and disability in this person. So interventions that should be accomplished in this stage of tertiary prevention are disability limitation, you're limiting disability, and also you're rehabilitating this person. You're not only limiting disability, but you're also making some rehabilitation issues. For example, you're helping this person psychologically, you're helping this person socially, you're helping this person to live even a socially acceptable way. So intervention in late pathogenesis phase occur at the late pathogenesis stage. It occurs when already the disease have developed into the disability or chronicity. So let's see the limitation of this disability I'm talking about. So to prevent or halt the transition of disease process from impairment and handicap is limiting disability. You're halting or you're preventing the progression of the disease into more impairments and handicap. So what is the difference between impairment, disability, and handicap? Impairment, it's any loss or abnormality of either psychological, physiological, or anatomical. You can have your leg, but if the leg is not functioning, you've lost the physiological function of that organ. If you lost your leg, that is loss of anatomical structure of the leg. If you lost your mind, such as maybe you're depressed, your mind is not functioning well, you're not mentally fit, you've lost your psychological function. Then another one is disability. Any restriction or lack of ability to perform an activity in the manner considered normal for a human being due to impairment. Of course, disability will come due to impairment. You're not able to do or to perform an activity because you're impaired, because you've lost your either psychological, physiological, or anatomical function or structure. For example, if you've lost your teeth, you've lost your anatomical structure of your mouth. You've also lost the function of the mouth because you'll not be able to, some of the function, because you'll not be maybe to talk well. You'll not be able to chew hard foods such as meat, such as githeri or things like that, kinakusi and the likes. So you're disabled because you lost, you're not able to perform any activity in a manner that is considered normal for a normal human being. Then for handicap, this is the disadvantage that comes due to disability. For example, if a child do not have teeth, when she talks to other children, the children will laugh at her. And if they laugh at her, the person or their child will start to have some self-esteem issues and will be antisocial with other people. So that person will say is handicap, because it is a disadvantage for a given individual resulting from impairment or disability that limits or prevents the fulfillment overall that is normal for a normal human individual or normal human being. For example here, if you have dental caries, you have an issue here, and you lose your teeth, or you lose your tooth, at this stage, you are impaired because you've lost your part of your body or part of your organs. And due to that, you're not able to talk well. So at this time, you're disabled. And due to these two, you'll be handicapped. You'll feel left out. You're not able to socialize well with other people. So this is an example of how impairment can lead to disability, and the two lead to handicap. Then rehabilitation. So rehabilitation is the combined and coordinated use of medical, social, educational, and vocational measures for training and retraining the individual to have the highest possible level of function ability. We are using medical, we are using social, we are using educational, we are using vocational measures for training and retraining the individual to the highest possible level of function ability or functional ability. Some of these medical intervention that you can use during rehabilitation is restoring of bodily functions. For example, if the person have been amputated, the part of the leg have been cut, that person, of course, have lost the function of the leg, and then they're not able to walk. So number one, we can use prosthetic legs through medical rehabilitation. We can also provide this person with, what do we call them? We call them crutches, the one that normally used when a person is not able to walk well, the support. Vocational rehabilitation, if that person have lost the leg or have lost the hand, how can you help this person to look for other ways to earn a living? How do you, it's a training that is normally done for that person who is handicapped, for that person who is disabled, in order for them to earn a living in another different way. If this person was running as a means of living, or there was another T, definitely do not continue to be arthritis because they have lost the function of the leg. But how can you help them to find another way of earning a living? That is vocational rehabilitation. Then the social rehabilitation is restoring family and social relationship. So how can you, if this person was self-esteem was very affected, you need to help this person in order to return back to himself and also be able to talk to their friends. You need to talk also to their families. You need to talk also to whoever they interact with each and every day in order for them to accept this person the way they are. And by accepting them, you're helping them socially. You're helping them to socialize well with this person as if they are normal human being. Then another one is psychological rehabilitation, and this is restoring of personal dignity and confidence. You need to psychologically help this person. Remember, they are handicapped now. They are still in denial. Why is my leg? Why did I have to lose my leg? What will happen to my life? Will I be a normal human being again? They're suffering from a lot of distress, a lot of stress, a lot of anxiety. So you need still to use psychological rehabilitation. So all this combination of coordination of this training and retraining of these factors, we call it rehabilitation. But we have different types of rehabilitation that have to be used in a combined way to help a person holistically. So we can use, we have to use medical, we have to use vocational, we have to use social, and we have to use psychological rehabilitation. So examples of this rehabilitation, we have establishment of schools for the blind, So when we establish the school for the blind, we are helping the blind vocationally, because we are helping and training them how to live a socially, to how to live a life that they can earn a living by use of their disability factor. Then exercises in neurological disorders, for example, if the person was amputated, you also have to help them through exercises in order for their nerve to be able to function well and for their body parts to go back to their normal functioning ability. Then prosthetic restoration of lost tooth, prosthetic restoration of lost legs and arms and the legs. Then you have reconstructive surgery in leprosy, where you're helping this person to recover. Then change of professional for a more suitable one, and modification of life in general in the case of TB, etc. So you can change profession if the current profession you're in, you can't fit in well. You can still change the profession. So by that, those are examples of rehabilitation. So as you can see, we have various stages of disease development. And these disease development stages can be prevented by various types of disease prevention mechanisms or interventions. We have the first stage, we have the second stage to the sixth stage. And in each and every stage, we have a disease prevention mechanism that we can use to prevent disease from occurring. So I think that will be the last part of today's lecture. So if you have any question, you can still use my the normal platforms that you normally use for any clarification. So all the best and God bless you.